begin tonight with a look at some of the pandemic-era protections that many have come to rely on over the past 3 years and that are now disappearing.
Two in particular involve supplemental food benefits and health coverage. Both have helped keep families healthy and whole during a difficult time, and the loss of this type of assistance, well, will bring an entirely new set of challenges. 3 News anchor Mike Gillespie is here now with more. Mike?
Well, Rudy, Leslie, over the last month, those who receive SNAP benefits have lost some of the extra money that they've been getting since the early days of the COVID-19 pandemic. But beginning this weekend, millions of Texans will need to look for ways to do without something else as well. The numbers tell us that 1 out of every 9 people in our state receives federal aid through the Supplemental Nutrition Assistance Program. It helps those with lower incomes buy food. But now, money that was added to the program when the pandemic began is going away. That means those same Texas recipients will have at least $95 less on their Lone Star card, and for some households, it could be even more. According to the Coastal Bend Food Bank, that creates stress for those who now have the worry of having enough money to buy food put back on their plate.
They have to budget for the small amount that they're receiving. Most people that are over a certain age are getting just $40 to $80. And with, food going up and inflation, it hurts them even more.
For some, that stress will be compounded when on April 1st, states will begin removing people who no longer qualify for Medicaid. According to the Texas Health and Human Services Department, nearly 3 million people in Texas who are no longer eligible are still on Medicaid because of the government's pandemic promise that they wouldn't be removed. But that promise is now over. In speaking this week with the group Protect Our Care, U.S. Representative Colin Allred says that now is the perfect time for Texas to expand Medicaid. In the meantime, it is important to keep these families protected.
I worry that our state is not prepared for the amount of processing that it will take to ensure that there's no lapse in coverage for these families. That's why it's so important that we do all we can to get these families the resources and information they need so they know how they can keep their family healthy.
Now, Health and Human Services will want to contact you as they check on your Medicaid eligibility, so make sure your contact information is up to date. One easy way to do that is to pick up the phone and call 211. But I did that this afternoon and they were having trouble with that line, so I've also put a link in this story on our website that will allow you to go online and set up an account called Your Texas Benefits. It also explains the change that's taking place.
All right, Mike, thank you for that report.